Welcome back, everyone, to another episode of Implementation Science 101. I apologize for my delay in getting these next couple episodes out. I'm going to change some things up, and I want to make this series better. You'll notice that this episode and the next episode, I will be much less scripted than I was in the first few episodes. I really wanted to make this change because it felt more natural, and when I teach, I never use a script, so why do that now? So let's get into it. So the episode today is about what implementation studies actually look like. And we're going to start with the refresher. We're going to be pretty general again. We're not getting into anything specific today because I really want you to understand the concepts involved before we move into more applied examples of real implementation studies. So as a reminder, we talked about clinical science, looking at whether an intervention works for the thing it's supposed to work for. So if you have a treatment for depression, does it treat depression symptoms? Implementation science, on the other hand, really focuses on understanding how best to help people do that thing in the best way possible. And you see there, our buddies are hand in hand here. They help each other out. What I really wanted to do today is help differentiate between what you might look for in a typical clinical trial where you're comparing one kind of treatment versus another and an implementation study. So let's talk a little bit about what that means. So features of an implementation study. So typically in an implementation study, we talked about in our last episode having a thing to implement. There has to be something being implemented. Otherwise, it's really hard to have an implementation study. The focus, you might think about zooming out. So instead of following patients over time, we're following healthcare workers, administrators, and maybe even whole clinics or organizations to see how they interact with the thing over time and how we can best help them do the thing. Another big distinction is that we measure implementation outcomes. And we're going to have a whole video on this for the next video, episode 4, so I'm not going to go into it. But we typically look at outcomes focused on the implementation of the thing rather than the clinical effect of the thing. And another thing that's really different is that we typically embrace change and adaptations and implementation studies, recognizing that we want our study to look as much like the real world as possible. So when this thing gets put into place in the real world, we want our study to look as close to that as possible because that's where we want to understand what's happening. So what actually happens in an implementation study? There is no one way that an implementation study looks, which is why I didn't present an implementation study today in depth, because I don't want you to get fixed in your idea of what an implementation study must look like. So I'm going to give you some basic features of how they typically look, and it's usually a combination of these things. So the first thing is that we typically evaluate and understand context in implementation studies. So that means that we're looking at things like barriers and facilitators to implementing the practice and doing it well. So we're really looking at what are the factors at the individual level, at the organizational level, that can really help or hinder the use of the practice. Another thing that might happen in an implementation study is that we build engagement and co-design plans and workflows for implementing and doing the thing. So it's frequently the case that we focus on working with the people who are in the setting to develop the plan for putting the thing into place. Another thing that we often do is we test or compare the effectiveness of implementation strategies. And so implementation strategies can be a lot of different things. The easiest one to think about is training. So we might look at different ways of training to see what increases knowledge, what increases self-efficacy, and those different ways of training might be a short training, like a 2-hour long training, or a longer training with a consultation component. And typically we're trying to figure out what is the most effective way to get people doing the thing in the best way possible. The other thing that often happens in implementation studies is that we're looking at adaptation, so adapting the thing itself. Sometimes our treatments need to be adapted for a different context, a different place. And sometimes we have to adapt our implementation strategies. So some implementation studies look at how those strategies are adapted over time. Now it's time for what I know you all are waiting for, which is our fun fact, which is not that fun this episode, honestly, but it is important. I have been talking a lot like implementation studies and clinical studies are separate from each other. And the reason I've done that is because I don't want you to confuse the two or to think that they're the same things because they're not. However, what we often see is that in implementation studies, uh, well, th that there's usually some sort of clinical component to it. And we call these things hybrid designs. And that's where we evaluate at the same time the clinical outcomes and the implementation outcomes in the same study. So we're going to have a whole episode on hybrid studies and how you differentiate them and understand them. But until next time, I just want to thank our sponsors. I want to thank you for coming back to watch this episode. I know we're not into the applied stuff yet, but I promise we'll get there, and I will be more prompt with our next couple videos. I want to thank our sponsors, Advance RI CTR and the Bridge program at Brown University. And I did want to say that you should keep bridging the gap. I'll see you next time.